Must you repay your health insurance subsidies after you have left covered California and your income goes up? The short answer is yes. Hello, I'm Kevin Knaus, a certified health insurance agent with Covered California, and I get so many wonderful questions and comments from viewers of my videos and on my blog, and there are scenarios that I really hadn't necessarily considered because families are different and they have different situations. And one of them was, I received subsidies at a lower income when I was in Covered California. I left Covered California, my income went up quite a bit. Do I have to repay them? Yes, although it doesn't seem intuitive that you would have to, because you were receiving subsidies at a lower income, and the subsidies were meant to make the health insurance affordable. However, Covered California and the other marketplace exchanges that are administering the Affordable Care Act are working from the IRS calculations for this subsidy, and that is all based on your final modified adjusted gross income when you do your taxes. So let's run through an example if you want to see all these boring numbers. Sue and Bob enter Covered California with an estimated household income of $50,000. Sue and Bob are 62 years old. The second lowest cost silver plan for them in their area was $2,500 per month. The consumer responsibility was $228, which meant that the subsidy that Covered California forwarded to their health plan, if they chose the second lowest cost health plan, second lowest cost silver plan, was $2,271. But where does that consumer responsibility even come from? Again, we have to go back to the IRS figures, and the premium tax credit is reconciled on Form 8962. And so I'll just go through the top portion of how that consumer responsibility is determined. Household of two, income of $50,000. You take $50,000, divide it by the federal poverty level for a household of two. That comes out to 287%. Their income is 287% of the federal poverty level. And then there's this table, and you go to the table, and at that percentage, the consumer responsibility is 0.0548 or 5.48%. In other words, Sue and Bob should only spend 5.48% of their household income, $50,000, on health insurance to make the second lowest cost silver plan affordable. That translates into $2,740 that they must contribute on an annual basis, or $228 on a monthly basis. There are a number of reasons why people leave Covered California. Sometimes they leave California. Sometimes they get jobs with employer-sponsored health insurance. Regardless, they leave, and oftentimes their income can go up. And that's what happened to Sue and Bob. They left Covered California at the end of August. Bob picked up a job, employer-sponsored, and their income also went up. So let's go back to the 8962 as if they were filing their taxes for the year. And they had still household of two, but now their household income is $100,000. It doubled, but Bob got a good job. $100,000 divided by the federal poverty level, and their percentage is 574%. Their income is 574% of the federal poverty level. That translates into an 8.5% consumer responsibility. Easy math. Their annual contribution to the health insurance is $8,500 or $708 per month. So we go back to the other slide. The second lowest cost silver plan that they were enrolled in, still $2,500 per month. Consumer responsibility of $708. Their subsidy that they were allowed at under $100,000 income is $1,791. So, okay, we have these two different numbers, and they were only in Covered California for part of the year. So how do you go through and add that all up? Well, on the second part of Form 8962, you go month by month if you weren't in Covered California for the full year. And those first two columns are right from the 1095A that Sue and Bob received from Covered California, which was the cost of the second lowest cost silver plan. They happen to have been in the second lowest cost silver plan. But you'll see column C is $708, and that is from the consumer responsibility that was determined up above on Form 8962. And then the subsidy should only have been $1,791, again, because they had that higher income. But column F, that has a much higher number in it. It has a number of $2,271, which was what they were receiving from Covered California. Covered California paid $2,271 to their health insurance carrier every month when they were in the exchange, because they had estimated their income at $50,000. And then you can go through the calculations, and Sue and Bob owe $3,840. Now, because Sue and Bob's income is over 400% of the federal poverty level, there is no repayment limitation. So they must repay that full $3,840. And here's another way of looking at the total numbers. The subsidy at $50,000 cumulatively through August was $18,173, but they were really only entitled to $14,333 based on the much higher income after they left Covered California. So again, the excess subsidy they need to repay at $3,840. Yeah, sometimes it doesn't seem fair and it can be complicated, but that's one of the reasons why I go through this, is to try and take out some of the mystery, and it does work, and it's just something that we have to keep in the back of our minds as we're going through Covered California. Now, if Sue and Bob had stayed in Covered California and their income went up, they would have the opportunity to increase the income, which would reduce the subsidy, which would potentially limit their liability for any repayment of the excess subsidy. But they had left Covered California. They had no opportunity to do that. Once those subsidies are paid to the health plan, they're done. There's nothing that can be clawed back. It's clawed back when you do your taxes. So if you have any questions or comments, you may leave them down below, and I'll do some research and do my best to answer them. Otherwise, for InsureMeKevin.com, I'm Kevin Knaus.